Neurodevelopmental disorders, ages 5 to 10. NDDs are defined as a group of conditions with onset in the developmental period, including deficits that produce impairments of functioning. Rosendahl, 2020. The development of the nervous system, the brain, and the spinal cord can be affected by a group of mental conditions called neurodevelopmental disorders. Neurodevelopmental disorders involve impairment development of the brain and the central nervous system that affect children's learning, communication, and behavior. Examples of these disorders are tic disorders, attention deficit hyperactivity disorder, autism spectrum disorders, and intellectual unlearning disorders. The symptoms of these disorders become increasingly evident as a child grows, develops, and may become permanent. Diagnosis of these disorders can be difficult, and treatment involves a combination of professional therapy, pharmaceuticals, and home and school-based programs. Tics are recurrent and sudden, involuntary, non-rhythmic motor movements, or vocalizations that involve motor vocal tics, Tourette's disorders, and coprolalia. Sue, 2022. Tic disorders are influenced by a variety of ecological factors and can be distressed with psychotherapy. Attention deficit hyperactivity disorder is characterized by attention problems or impulsive hyperactive behaviors that are unusual for the child's age and developmental level, which is the most frequent diagnosed mental disorder in preschool and school-age children. Autism spectrum disorder is defined by many social communication and behavioral impairments. Children have a hard time communicating with ASD and do not speak at all. Intellectual disabilities are characterized by intellectual functioning before the age of 18 and include impairments in life skills such as communication, self-care, home living, social or interpersonal skills. Learning disorders affect the way the brain can receive, process, retain, and respond to information. A child with a learning disability may have trouble learning and using certain skills like reading, writing, listening, reasoning, and doing math. Learning disabilities vary from child to child. Neurodevelopmental disorders are disabilities associated with the neurological system in the brain. The causes for these disabilities in children can be biological, psychological, social, cultural, genetic brain abnormalities, or brain injury trauma. Tics and Tourette's disorder. Tics are unexpected, recurrent, and involuntary body movements or vocalizations. Children and young adults diagnosed with Tourette's syndrome frequently experience emotional, behavioral, or developmental challenges, including anxiety, obsessive compulsive disorder, attention deficit hyperactivity disorder, and learning disabilities. There are 3 classifications of tic disorders: provisional tic disorder, persistent tic disorder, or Tourette's syndrome. Tic symptoms begin early in childhood, however, they are temporary or may disappear without treatment. Provisional transient tic disorder is diagnosed when a tic has been present for less than 1 year. Persistent tic disorder, chronic motor or vocal tic disorder, is diagnosed for tics lasting more than 1 year, that peak prior to puberty and decline or disappear during adolescence. Symptoms may be improved through compensatory neuroplastic brain reorganization that allows affected teens to suppress and control their tics. Tourette's disorder is characterized by multiple motor tics, blinking, shrugging, jerking of the head or shoulders, and 1 or more vocal tics, repetitive throat clearing, sniffing, or grunting that are present for at least a year. 10% of people diagnosed with Tourette's syndrome experience coprolalia, the involuntary uttering of obscenities or inappropriate remarks. Tourette's create comorbid conditions like poor anger control, attention deficit hyperactivity disorder, OCD, impulsive behavior, and poor social skills that affect the individual's quality of life. Tic disorders are influenced by genetics, neurochemical abnormalities, brain structure, stress, negative social interactions, anxiety, excitement, and exhaustion. Treatment for Tourette's involves psychotherapy, habit reversal, and medication. ADHD. Attention deficit hyperactivity disorder is a developmental disorder marked by persistent symptoms of inattention and or hyperactivity and impulsivity that interfere with functioning or development in children. Symptoms and diagnosis begin with children before the age of 12 for at least 6 months. Preschool, school-age children, 5 to 10. Also experience ADHD symptoms. They tend to experience limited attention, impulsive actions, high levels of energy that affect their daily lives. ADHD interferes with social and academic functioning. It produces attention problems, hyperactive behaviors that are unusual for the children's age, gender, and developmental level. Higher than average energy or impulsivity and disordered behavior that interferes with day-to-day functioning. The causes of ADHD can be biological, psychosocial, social, and sociocultural. The treatment for ADHD is medication, Ritalin stimulants, SPN 812, which is a non-stimulant, behavioral and psychosocial treatment programs. In young children, hyperactivity and impulsivity are the most common symptoms. In elementary school, inattention may become more prominent, leading children to struggle academically. National Institute of Mental Health 2024. Autism spectrum disorder is characterized by the impairment in social communication skills and displayed by stereotyped interests and behaviors. ASD is diagnosed when a child experiences deficits in social communication and interactions and repetitive behavior, restricted interests, or activities. These activities involve repetitive speech, movement, use of objects, intense focus on rituals and routines, intense fixations or restrictions, interests, and atypical sensory reactivity. ASD also occurs in combination with other physical or intellectual conditions. Autism spectrum disorder is usually diagnosed in children between 3 and 7 years of age. Early recognition can help reduce symptoms and support development and learning. Children on the spectrum may find it challenging to make friendships, take part in conversations, or find common interests with other children. Autism is caused by biological factors that are inherited as well as psychological factors that relate to deviant parent-child relationship. Children diagnosed with ASD require support throughout their lifetime and early intervention to increase their cognitive adaptation and functioning. Medication is given to children to decrease their anxiety, repetitive behaviors, and hyperactivity. Oxytocin is also given to children to increase social functioning. Comprehensive treatment programs are also offered to develop functional skills. Pivotal response treatment reduces self-stimulation behaviors and helps children develop communication and social skills. Intellectual and learning disabilities. Intellectual and learning disabilities are neurodevelopmental conditions that affect functioning in two areas. Cognitive functioning, learning, problem solving, and judgment, and adaptive functioning are activities of daily life, communication skills, and social participation. IDs can be diagnosed through measuring an individual's IQ. An IQ score of 70 to 75 shows a significant limitation to intellectual functioning, but the IQ score must be interpreted in the context of the person's difficulties and general mental abilities to be efficient. Adaptive behavior are social and practical skills that have been learned. They are performed by people in their everyday lives, which include the following: conceptual, social, and communicational skills, and practical. IDs can be associated with a genetic syndrome such as Down syndrome or Fragile X syndrome that may develop following an illness. IDs may result from head trauma during childhood or from exposure to toxins like lead or mercury. IDs can be caused by brain malformation, mental disease, and environmental influences. Labor and delivery events, infection during pregnancy, and problems at birth can also cause ID. When AZ or ID is identified early, children participate in individualized home-based or school-based programs that focus on decreasing inappropriate behaviors and maximizing skill development. ID is a chronic condition that impacts a child's ability to think, understand, and perform daily tasks. Children with ID may have difficulty with reading, writing, arithmetic, time, money, understanding social rules, and making friends, using good social judgment, practical personal care, managing money, organizing their day, and communication. Signs of ID may appear in late preschool or early school age. IDs are caused by genetic conditions such as Down syndrome, Fragile X syndrome, and ketonuria, PKU, complications during pregnancy, such as the mother drinking alcohol or getting an infection. Problems during birth and diseases are toxic exposure. Treatments for IDs are special education and behavioral therapy, vocational training, family education, medications to help with related conditions, and community support. Conclusion: the development of the nervous system, the brain, and the spinal cord can be affected by a group of mental conditions called neurodevelopmental disorders. Neurodevelopmental disorders involve impaired development of the brain and the central nervous system that affects children's learning, communication, and behavior. Examples of these disorders are tic disorders, ADHD, autism, and intellectual and learning disorders. These symptoms of these disorders become increasingly evident as a child grows, develops, and may become permanent. Diagnosis of these disorders can be difficult, and treatment involves a combination of professional therapy, pharmaceuticals, and home and school-based programs. Neurodevelopmental disorders are diagnosed using a variety of tests and evaluation to assess a child's development, growth, and learning. Children experience delayed or impaired speech or language development, difficulty socializing or interacting with peers, impaired motor skills, inability to focus or concentrate, and behavioral problems such as aggression, hyperactivity, or mood swings should be evaluated and tested. The causes of neurodevelopmental disorders can be biological or environmental, relating to stress, anxiety, and trauma. Thank you.